So the sugar diet actually seems to work. That's according to Mark Bell and the videos that I have been binging on recently in the last few days, trying to understand why this new sugar diet is trending and if actually those results are legit. I'm Dr. Jesus Vega, and I'm stepping in for Dr. Brewer, who wasn't able to join us today for the show. Nevertheless, I had a long conversation and discussion about this specific topic with him, and I'm glad to announce that we agree in most of our views regarding this exact topic. So, this is not going to be a bashing video about attacking personally the people who are promoting this diet. I'm genuinely interested in on learning more about it, and today I'm going to share you as far as I have come to in regards to this diet and why it actually works. Um, there's a caveat though. There's nuance regarding this, of course. So this is what the sugar diet is supposed to be like. Yesterday, Mark Bell posted yet another video where he was a little bit more clear on how to do this sugar diet, and I hope I'm expressing this the right way. He said, if you want to do a sugar diet, these are the types of food that you should be eating, and this is kind of a his protocol that he is talking about. Uh, fruits, fruit juice, honey, maple syrup, and candy. So that's what he says. If you're not eating these types of sugar, it's not a sugar diet. So let's be um, respectful about that part and use that as a reference. So he says for a few days of the week, most days of the week actually, maybe 1 or 2 days, you're not gonna be eating anything but that. And then he says on the third day, you can eat like some amount of lean protein, some vegetables, and even some small starches here and there. And then you continue your sugar fasting. And the idea behind that is that by eating that way, you are pushing your metabolism into burning fat. Okay. And he also gives like a cheat day once a week, but he's very clear that he has a perspective a little bit different from Cole Robinson, snake diet guy, who also promotes a thing like this, where he says he's concerned about people binging on carbohydrates. So he's not recommending binging on carbohydrates. And I think the main proposal behind the diet, it has the heart on the right place, where he's saying, okay, there's a obesity and diabetes epidemic, which I agree, and we have people deep on the hole that are on this carb addiction and they cannot go out. So by allowing people to eat some type of sugar and at the same time losing some weight, that can lead them onto the right place, right? Whatever that diet is for you. Okay, so far so good. When you see how the sugar diet pushes the metabolism into burning fat, there are a couple of mechanisms that have some scientific backup. So, first, by not consuming fat, you're pushing your metabolism into burning the fat you have. But what makes different the sugar diet from fasting alone is that when you're fasting, you're not consuming any sugar. So it's easy. It's harder to go through a fasting if you're not trained to do that. So he's saying, okay, if I cannot deal with the weakness that comes with a regular water fasting, I'm going to do some of the sugar, put some sugar in, recover some energy, and my body's going to still burn fat. And that's partially right. You are going to be burning some fat if that sugar is not enough to use the energy that you need to use. That's kind of the point. One big difference is when you're doing prolonged fasting, we actually do not recommend doing a lot of exercise. When you're doing this type of sugar fasting, exercising actually, it's going to be a little bit easier because you're actually putting some fuel that you're going to burn quickly. Okay, so good. So at this point, it looks really good, right? I can lose weight while I'm eating sugar still. And I think the big difference between the sugar diet and the keto diet is this part right here. When you're doing keto diet or you're doing a low carb diet, you are training your body into metabolize fat both the fat that you're putting into your body, but also the fat that you have stored. When you're doing this type of sugar diet, you're not using any any outside fat, any dietary fat. So the body only has the option of either eating sugar, your inner fat, or protein. The one thing that has some validity on this, well, a few things, is that when your body is less likely to eat protein, so you don't lose that much muscle mass. And that's kind of a big difference, because when you do water fasting, you're going to lose some muscle. When you do this sugar diet fasting, you're not going to lose that much muscle. So in both ways, you can actually burn some fat. I think that's true. So this is kind of the big positive from the sugar diet that's being proposed, right? So you eat only sugar, start losing fat. The sugar helps you not to burn that much protein. And on the third day, you put some lean protein in, so your body can use that as well. Okay, everything looks really, really good so far. How sugar helps keeping muscle. And we are starting to advise some of this introduction of carbohydrates. I don't necessarily agree with fruit juices, honey, maybe honey a little bit, maple syrup, and candy. I don't agree with that 100%. I think some carbohydrates can be still used as fuel right before or right after an intense exercise workout or intense workout. And this is the reason. Some insulin, even though high levels of insulin will keep you from burning fat, insulin also is an anabolic hormone, meaning it can help you build muscle. So putting some glucose and using some of that insulin might actually help you build some muscle. Storing some glycogen and lowering cortisol levels, that amount, when you use carbohydrates the right way, right before, right after the exercise, can help with this. This is something that people who go to the gym have known from years, right? You see the people who go to the gym and they're jacked, they're usually eating chicken and rice, so carbohydrates and protein. So there is some truth on using some amount of carbohydrates just the right way, right before, right after the exercise. And this is the reason why. So you see, the muscle has multiple receptors. It has receptors that require insulin, and it has receptors that don't require insulin. So the GLUT4 receptor is the one that requires insulin, and you can use that. GLUT1, GLUT12, GLUT3 are actually insulin independent, meaning that when you're exercising a lot, you can use that glucose for energy and create more muscle without requiring that much insulin or bypassing insulin. So you can use insulin, or you don't necessarily need insulin to build muscle, but you can do that by using the right amounts of carbohydrates. So at this point, I think that's why there's a lot of hype, and there's this trendy perspective on, oh yeah, this sugar diet is fantastic. It's gonna help you burn fat without losing muscle. So if you're overweight, it sounds very, very appealing. But here's the caveat right here. So we have over here a comparison between two hormones. One of them that I heard a lot, they saying that this is one of the key reasons why the sugar diet works. And it's because it stimulates this hormone right here that is called fibroblast growth factor 21. So this fibroblast growth factor 21 is a catabolic hormone, meaning it helps you burn stuff. In this case, helps you burn fat. The literature says actually increases insulin sensitivity. So the more glucose you put in, the insulin is going to be more effective in using that. But the caveat here is this is a short-term positive effect. That's one of the issues. In the other hand, we have insulin-like growth factor, which is kind of the opposite hormone working against the FGF21. And insulin growth factor is actually an anabolic hormone that, yes, might temper a little bit the effect of burning fat, which is the same thing that insulin does. But as well as insulin, they also can promote growing muscle and actually help with bones and actually promotes a healthier metabolism balance. The thing is, you don't need that much IGF-1. You also don't want to have it too low. When the sugar diet applies, what they have seen is that you see an increase on FGF21, at least theoretically, but you see a decrease on IGF-1. So as you can see there, the translation for all of that is you're going to be able to burn fat without messing up your muscle mass, but you're going to tamper your ability to build more muscle later. And also, you're tampering your ability to use insulin and improve your insulin sensitivity on the long term, which that's what insulin growth factor helps you to do, to manage your metabolism between fats and carbohydrates. So that is kind of the big conundrum. I'm going to be losing weight because I think you can. I mean, Dr. Brewer has old videos of the potato diet that Penn Jillette from the Magicians, Penn and Teller, did a few years ago, where he lost a bunch of weight by eating only potatoes. You can do that. One thing they I heard Mark Bell said was, well, if you're eating that protocol and eating the maple syrup, the fruit juices, and all that stuff, and you're not seeing the results, maybe you're eating too much. And that goes back to calories in, calories out, which, don't get me wrong, I think there's some validity. And I actually think that's probably one of the most important factors here and why it works. Some hormonal influence, but I think that if you're just eating sugar, you're probably not overeating on calories, which he also says by cutting fat, which has a lot of calories on that. But the problem here, right here, comes where I don't think they believe, and to them the evidence is not clear, that insulin stops fat burning. And when you're on a sugar diet, the more sugar you put in, your insulin is going to go up. And that insulin long term is going to tamper the effects of keeping that fat burning. And that's the thing where they say, no, that's not like that. That's the carbohydrate insulin model that's been promoted for years. It's not working. I think if you're just saying it's calories in, calories out, and neglecting the role of insulin, that's the incomplete picture. There are multiple factors involved on how we manage energy inside of bodies, and I think both have a place, as well as obesogens and other factors like oxidative stress. So this is the downside of the diet, the sugar diet. One thing is it hasn't been scientifically tested just yet, both short term and long term. What we have is people in the comments saying, okay, yeah, I did it and I lost a bunch of weight. I will argue that if you're on a caloric restriction, even if you're eating only fat or eating only protein, you are going to lose some weight. Probably the biggest effect is going to be, maybe I'm not losing that much muscle, which is a good thing. We don't want to be losing muscle, especially if you're older. But the problem long term becomes to this: the macronutrient deficiencies that you're going to get by eating too much fruit juice, high corn fructose syrup. I don't think he's advocating for that. But just the fructose from fruit juices can increase fatty liver. Over time, just like you get resistant to insulin, I've seen evidence that you also can get resistant to FGF2 and 21, where at the beginning it might be helping a lot on burning that fat, but you can also get resistant to it, but just because too much insulin, too much glucose in your bloodstream over time. Metabolic flexibility may decline, which is that capacity from switching from sugar as fuel to switching to fat and protein as fuel, or specifically fat. Over time, as you see here, he's not recommending doing sugar fasting all day, every day. He's saying most days. But when you try to now use protein as fuel, and he's not advocating really about introducing fat. This is a low fat diet, basically. Whenever you want to try using more fat as energy, and the nutrients that fat has on it, which a lot of them, the cholesterol in it, and some of those nutrients are very important for hormonal function and cognitive function. And you're not getting those from diet. You're not getting that from the fat that you're eating out, from out sources. That's going to be a major issue, because when you're trying to introduce some of that fat again, the body's going to have a hard time metabolizing that, just because it's so used to burning glucose, and you might be developing high insulin levels. And the eating disorder risk, of course. The whole point to allowing some glucose is to avoid you to binge on some additional glucose. That's the thing. But that's kind of the problem that can come up after that. So though all of those are, I think, are valid points to argue and ask about. And there's no research that I have seen that has evaluated that just yet on this diet. There's plenty of research showing how processed carbohydrates are a problem. There's plenty of research showing how excess fructose is a problem. I think this is the part where we are mostly concerned. Okay, so you lose some extra pounds, you're losing some fat, which we know fat is involved also in plaque development. So that's good, burning that fat away, losing weight. But high levels of glucose chronically, high levels of insulin chronically, we know that they trigger cardiovascular inflammation, and we know that that leads to heart attacks and strokes. So much so that 30%, a little bit even more, that people who do bodybuilding are going to be developing heart attacks and strokes. Part of that might be because of this. Part of that might be because the enhancing performance drugs, hormones that they consume. That's when I see that that's a little bit misleading sometimes, where if you put on a thumbnail like we just did, this is based on one of Mark Bell's thumbnail where he says sugar diet and then points out him, which he's jacked. I mean, who doesn't want to be jacked like that, right? But what's the reason behind being jacked? And he has been very transparent. He uses some of those performance enhancement drugs. One drug, and specifically one hormone like growth hormone, can push and promote IGF, which can counteract against this effect of the sugar diet decreasing IGF. You inject growth hormone, so you get more of that IGF up. So that can actually help you even build muscle on that space as well. But I think the downside is, what's the price of getting jacked? And what's the long-term gain of getting jacked? You might feel good. You might look healthier. Muscle strength is, of course, very, very important. But this is where we say looking fit doesn't necessarily mean being healthy. And the one problem that I have with the approach of like this is just relying or putting all of our efforts on how I feel and how I look, and minimizing the importance of measuring and getting data to really assess what's your own cardiovascular risk. And don't get me wrong, I think at the end, if you want to try the sugar diet and lose some extra pounds and see how you feel in a few days, by knowing what are the pros and cons of the diet, I mean, go for it. I'm not against experimentation. But I think it's important for us to put all the information in front of you and telling you, okay, these are the pros of this new trendy diet, and these are the cons and the things that you need to be careful of and take a look at. Before I go to any ads, I think that's kind of my 2 cents or 2 cents in regards to this diet. There's too much that we just don't know yet about it. I'm not bashing against it. I think there's a moment where the ketogenic diet and paleo diet and all those diets had, the Atkins diet had all the same kind of pushback from the medical community. And over time, they were more broadly accepted because of the benefits they provide. But that's up until the moment you start measuring what happens and what are the risks and what are the benefits. At this point, I think sugar diet it's too early to really say, yeah, long term is a good option to just do that. I personally, I'm not a fan of fruit juices. I'm not a fan. I do eat some fruit, but I'm not a fan so much of fruit juices. I can binge on orange juice, so I just try to avoid it. I'm not a fan of candy. I'm not a fan of honey. I mean, they at least candy will mess up your teeth. Maple syrup, no need to say. So I think that's kind of the major issues that you want to be aware of, and that's the kind of stuff that we want to just point out. All right, so let's go to your questions and let me know if there's something that I misrepresented or something that I'm wrong with. Let me know. I'm happy to hear it and read it, because we want to bring you the most honest and truthful information so you can make your own decisions. So Gilbert, why don't we go to the Q&A and let's move on. All right. So before we go to the questions, Gilbert, we have a banner over there that we want to promote. We have a new line of supplements from Dr. Brewer. Of course, the metabolic risk kit assessment, which we're making some changes to it. So we're not giving away one today just because we want you to stay tuned, because we have received some feedback and there's room to make it even better. So that's what we want to do. There's a phone number over there if you want to call and get more information about it, and also about the new line of supplements from Dr. Brewer. As we said over and again, we have said it from day one. Supplements will not replace your lifestyle, but they can help you get that extra step if you want to do it. So I won't spend too much time on it. I don't want this to be too spammy, but give us a call and get more information about it. I think the number is just, I didn't have my glasses, 859 300 0395. 859 300 0395. That's the number right there. All right. So let's go to the questions right now. First of all, a shout out to Dan G, who just became a member, Carl Lee, Brad Oakley, and Just David. $5. Thank you so much. Those go a long way. We didn't post the members video just yesterday. We had a technical issue. We didn't hit record. So we record the stuff. We thought we were recording. We didn't. I think I'm going to be recording that. I'm hoping to post that today or tomorrow at the most. And we're going to talk about oxalates. So that's going to be a members only small short video for you guys. Just we didn't forget. All right, Brad. Morning, Doc. What are the health risks of using iodine or gadolinium as a contrast agent in CT angiogram scans? Can a scan be effective enough without the contrast agent? It depends on what you're using it for. So if you're doing a CT angiogram, if you don't do the contrast, the quality of the image you're going to see is going to be less clear. It's not going to be as effective. It's important to use the contrasts to make sure that we have the right assessment. And it just provides more value. I don't think you can even do an angiogram without the contrast, actually. The thing is, iodine and gadolinium, they are pretty much very, very safe, especially in those circumstances. Some people can be allergic. That's one of the major risks. And the other one, which is still discussed, is the kidney damage. I think it's more accepted that people who have poor kidney function, like stage 5 kidney disease, stage 4 kidney disease, might need to be more careful about it, just because the elimination is going to be slower. But other than that, I think if you just do it maybe once every 5 years, I don't see that many issues. That's what we have seen on the evidence. I know nobody likes to have some foreign substance on your body, but these are tools we use to evaluate with more in a more precise way if you have any cardiovascular risk. Waka Squarishi, does healthy snacking a good idea in between meals in pre-diabetic patients, or totally avoid snacking to keep insulin low? That's a great question. I think it depends on what you're snacking on. If you're snacking on glucose and sugar, I probably won't do it. If you're snacking on nuts and you can eat nuts, you don't have an oxalate problem, which always comes into a conversation about it. If you're snacking on vegetables, if you're snacking on maybe dried beef or those strips of dried meat, I think there's no problem without it about it. Depends on what your goals are. So if you're wanting to lose weight and not want to use the sugar diet, most people that view the channel, most people that are patients of ours, are using intermittent fasting. So you're fasting 14, 18 hours a week. So that's another way that you can do it. So I don't mind about snacking at all. Depends a lot on what you're trying to do and what you're snacking on. How much protein we need to maintain muscle mass, specifically after age 50? Does protein also increase sugar and insulin? Any suggestion for healthy protein that have low impact on blood sugar? Yes. So that's a great question, and I think it fits perfectly from to what we're talking about right here. Especially after age 60, it gets harder and harder. And one of the major problems that conversations come in regards to protein is that too much protein is going to damage kidneys. And recent studies have shown that actually the threshold for using protein without damaging kidneys is far bigger than we thought. So you can go from 1.5, even 1.8 grams of protein per kilogram of body weight, and it's still a good amount of protein. what we have seen in regards to how to actually keep muscle mass or grow muscle mass as you grow older with protein is, one, carbohydrates might actually help. And I personally, I mean, this is a conversation that I have yet to have with Dr. Brewer specifically. But for people who are older and who are very thin and they're doing low carb diet and inflammation markers are low, and now they're concerned about sarcopenia, which is that muscle loss, I do recommend including some carbohydrates. I just don't recommend fruit juices and I don't recommend candy. I do recommend more maybe starches and even some fruits, not fruit juice, but fruit with bunch of fiber on it right before the exercise or right after the exercise. And also adding creatine. Like creatine is a real game changer. Very few to none side effects have been seen on it. 3 to 5 grams a day. Even you can try. There's studies showing loading doses of 25 grams the first 5 to 7 days, and then going back to a 3 to 5 grams of creatine a day. Any of those protocols have seen that have worked. Creatine, some carbohydrates, enough protein, and this is the most important part. You have to do the work. If you're not doing resistance training, if you're not doing high intensity interval training, you can eat as much creatine as you want. You can eat as much protein as you want. You can eat as much carbs as you want. You're not gonna keep that muscle. And that's one of the things that on the sugar diet they kind of touch on it, but I didn't, maybe I missed it, but I didn't hear clearly when they were the part where they should say, hey guys, we are bodybuilders. We spend hours in the gym, hours. So I think that's a major factor for this type of diet or any muscle mass that you want to bring up, that you need to do. You cannot skip the exercise. You cannot expect that just by what you're eating, you're going to keep or build muscle. You need to move that muscle, because that stress that you create on the muscle, it's gonna be more effective into building that muscle mass and keeping it. That's mechanical traction and metabolic traction that you need. And as I mentioned, the more you move your muscle, the less insulin you require to keep that muscle and build more of it. So that's kind of my perspective, my $1 take. If you're doing an extra low carb diet, I think, I mean, if you define low carb diet, you can go, depending on who you read, 35% or less of your calories that you're eating every day, or you can go through 100 up to 150 grams of carbs a day. I mean, that's too flat just because there are different factors according to your weight, age, BMI, whatever. But many people who are having a very restrictive low carbohydrate diet might benefit from adding some healthy carbohydrates to gain some muscle mass. That's my perspective, personal perspective. Emmy Farrell, high insulin damages kidneys and causes chronic kidney disease. Are you best mind with carnivore diet? Yeah, I mean, of course. I think similar to this situation, like on the carnivore diet, we don't necessarily advocate for everybody to do carnivore diet. And both Dr. Brewer and I were on Dr. Bob Kiltz. If you heard from him, he's one of the major advocates of carnivore diet. And we told him, like, Dr. Brewer and I were actually more omnivores. We do include some other food groups, but we acknowledge that carnivore diet has also plenty of benefits, have a lot of anti-inflammatory effects just because of that restriction from sugar and insulin. So that's it. All right. So I mean, we haven't reached even 30 minutes from the show just yet. Let's hit some questions from non-members. And let's see if I can address them. Some of them are hard. JMK2921. If I eat one teaspoon of sugar, table sugar, how much glucose in grams I am eating? Depends on what you look for. As far as I know, it's not that much. It's like 4, maybe 5, 6 grams of sugar. The thing is, this is simple sugar, right? This is the sugar that's going to go straight to your bloodstream. Most of that is going to reach your bloodstream. So that's kind of the issue right here. I think I have heard Dr. Brewer said, I don't mind putting a tablespoon of sugar in my coffee, right? As long as you're not fasted at that moment. We do recommend any carbohydrate that you're going to do it before eating your fiber, fat, or protein, just to minimize that. And there's one thing that I didn't answer, though, in one of the previous questions. The question said, those protein raise blood sugar and insulin? And I will say it can. So when you're breaking protein to use as fuel, you do raise some insulin, just not as much insulin as you do when you consume carbohydrates and glucose. And some of that protein, in order to be used as energy, is going to be breaking down and going to a specific pathway to be transformed into glucose that can be immediately used. I think there's no doubt, like, nobody lives with a blood sugar level of 0. Blood sugar is necessary. It's a fast fuel that we use as energy. The problem is when you have too much of that fuel. That's the major issue. Or you consume too much of that fuel that starts storing in your liver as glycogen, gets stored as fat below the belly, below your skin, but also between your own muscles. That muscle becomes like marble, and it's too much fat on that muscle, and that tempers the effectiveness of growing muscle as well. There is fat between the muscle that if you have too much of it, you need to start exercising and burning that fat as energy, and especially that fat that the muscle has an immediate access to burn and use for that. Michael Pregler, this trending diet, if you want to call it, is that has me wondering, where does your nutrition came from? Isn't that the reason for eating? Trying to understand the question. But the one thing that I agree with Mark Bell and Cole Robinson, I think most people are not eating the way you guys are eating. Most people are not doing low carb. Most people are not doing ketogenic diet. Most people are on the standard American diet. The perspective, though, changes because they say, okay, the standard American diet, probably the main problem is fat, not so much glucose and carbohydrates. And that's where we don't necessarily agree. Well, we think it's both unhealthy fats plus the refined carbohydrates. What sugar oxidizes your body over the years to create two conditions for cancer? Yes. It also may be addictive, more addictive than cocaine. Yes. Look at the Eric Clapton interview. He said the first substance he got to abuse was sugar, not any other hard drug. Highly processed, no good for you. Yes, I agree 100%. There's one more thing. IGF, for example, when it's too high or too low, actually can be a problem in regards to cancer risk. So keeping that balance of IGF-1, insulin growth factor 1, is important as well. Is a sugar diet caloric restriction in the absence of fats and protein? I think this is my personal take. I think most of the benefit of the sugar diet is because exactly that. Yes, FGF21 might have some role in it. There's some hormonal impact on using more of that. But that's it. You guys don't believe this nonsense, do you? Well, that's what I'm saying. I mean, how do I put it this way? If you have seen a snake oil salesman, those guys are really good on hiding BS behind some truths. Now, I'm not saying the sugar diet is BS. I'm just trying to highlight what is real. Because if the claim is the sugar diet makes you lose fat, yes, it can. Can you lose fat without losing muscle? Yes, it can. I think I heard Mark Bell saying it's like using a flamethrower. I agree. So do you want to try it? Do you want to go through that? And that's okay. Just know the risks. That's the thing. High fatty liver risk for those already insulin resistant. I agree. I think that's the problem. It's assuming that that those people who are already obese and have insulin resistance do not have FGF21 resistance already, and even they will burn fat by not eating that much, because most people who are diabetic and obese are eating too much. Most people, and there's this other part where if you ask any nutritionist, they will also go to the route of, okay, there are healthier ways to lose weight. And even Dr. Brewer and I don't necessarily agree 100% with anybody. So that's why you see partial agreements in this. But there are unhealthy ways to lose weight, like cancer or uncontrolled diabetes. The problem there is that you cannot burn glucose; you're burning your muscles, and it's a different thing than the sugar diet, though, and specifically on those two cases. White sugar causes insulin resistance. I know, as I have type 1 diabetes. Yeah. Uh, I don't know. I only heard Mark Bell said this once, and I'm telling you, I binge watch his content. I watch a bunch of stuff, hours of it. I listen to it and try to digest it, and I hope I'm not misrepresenting. But at some moment he said, "Oh yeah, even type 1 diabetes, maybe," and then he kind of thought about it and said, "Well, I don't know, maybe." I don't think putting that much sugar into an insulin, a type 1 diabetic, is a good idea because they don't have insulin. White sugar is highly inflammatory. Yes, and inflammation leads to disease. I think we all agree with that. Uh, will optimal blood levels of vitamin D and magnesium help minimize the damage to the coronary endothelium caused by hyperglycemia? I think there's enough research and evidence to support that idea. Definitely. Vitamin D, magnesium, both have shown to have anti-inflammatory and protective effects for vessel health. Yeah, I think that's what I'm going to say. I don't think both. I think we need to make this clarification. That doesn't mean that you can keep your blood sugar levels high enough just because you are supplementing with vitamin D and magnesium. That's not going to work. Nay Bulmer, that's my conviction. Sugar fasting logic seems like it could set one up for long-term health problems. Sugar addiction, reactivation, beta cell overload, fatty liver, dementia, gout, you name it. Yeah, I agree 100%. That's the thing. It hasn't been tested. The current evidence and the stuff we know so far points to that direction. And I personally, I don't think I'm going to be the one to test it. But there might be some people they're frustrated and want to lose weight and will be up for anything because maybe keto hasn't worked, maybe low carb hasn't worked. They don't like feeling those cravings. They feel tired. They feel sluggish. Water fasting doesn't work for them, or they don't like it. I mean, I understand the frustration. I've discovered walking makes me lose lots of body fat in 2 weeks. I've lost 1.2%. I do 10 to 13-minute walks every other day. Then I bodybuild and use my slider machine daily activity. Yes, I mean, you got to keep moving. Glad I found this. Sitting here as a lean mass hyperresponder with a 5,600 calcium score. 50 years old, no stents, no status, asymptomatic. Fantastic. I think we haven't addressed that Gil Carvalho's video, Frank Gil Carvalho, where he dissected and basically talked about some of the what he considered the flaws of the keto trial, the plaque begets plaque study. I haven't seen Nick or Dave mentioning any of that recently. Maybe I missed it. Maybe there's a video somewhere there that I haven't seen. We are working on a cholesterol video where we're mentioning that conundrum, that nuance, and that problem with those findings. I think we all agree at the end, and I probably was a little bit too edgy when I said, yeah, it seems that for these people, plaque's not a problem. Even Dave Feldman put the brakes on and said, yeah, I will not endorse that message. I mean, we're saying we're researching this, and it seems that there is some plaque progression. The one thing that I don't think we agree 100% is that they are saying, everybody's saying, non-calcified plaque is soft plaque. And that's where Dr. Brewer and I don't necessarily agree. Non-calcified plaque to us doesn't necessarily mean soft plaque. I mean, there's a big difference between low density non-calcified plaque, soft plaque, and non-calcified plaque. So there's a lot of caveats right there where we're not making bold conclusions just yet. Good morning from Central Florida. I need to go through from 26% body fat to 9%. And at that rate, I'm going to take until November, December to reach. That's 2.5%-ish per month. 7 months it would take me. Okay, that's okay. We personally don't think that you need to go to 9% body fat. I mean, anybody. We believe that just a level between 28 18%, especially as you get older. That's good enough. But I mean, by any means, if you can go even lower, I mean that's fine, as long as you have enough fat intake to keep your hormones working as well. I'm gonna see if there's another question more than just a comment. 1,000 calories of protein. It's four. I believe it's 4 grams, 4 calories per gram in protein. So I have to do the math. I'm not good at math. Um, yeah. Pure bologna diet sounds like the diet I live for most of my life. I love candy. Yeah, a lot of people do love candy. It can be very addictive. Uh, I personally don't, but I know plenty of people who do. Um, any other? Okay, taking beet supplement works. If you're talking about blood pressure, yes, it might work. There are some studies that show some significant blood pressure reduction with beet supplements or beetroot use. Uh, yeah, we did a video about it. Top 5 at-home remedies to lower blood pressure. So yeah, we covered this snacking question. Okay, this one. No, I think it's true. When you're on a low carb diet and then take a little chocolate now and again, it seems to work. Yeah, I mean, the one thing they're gonna see is that when you're introducing some carbohydrates and you're used to low carb diet, you might feel more energy. Uh, it takes a while. It takes days or weeks to really get fat adapted and don't feel tired without eating sugar. Uh, but that's the thing. If I was Michael Pregler, if I was diabetic, thank God I am not. I wouldn't touch 1 gram of sugar or a plant ever in my life. I think that's fair. Any other question that I'm missing? Okay, so okay, one here. Bananas, are they okay, and how many? Thanks. I personally avoid bananas because they, even though they are in defense of glycemic index and glycemic load, meaning how much they spike your blood sugar, I personally have seen my blood sugar go up to 200 with just one banana. Caveat here again, I'm not against the idea of trying maybe more maybe not so ripe banana and doing that before workout or after workout. It might help if you want to get that extra boost and build some muscle. Other than that, I personally don't eat it regularly. I can see my blood sugar go too high. So that's the thing. The big food industry is going to love this new sugar diet. Meanwhile, the metabolic health of the American population will be going further down the drain. Yes, I think that's the major issue. Has anybody seen Dr. Baker lately? He hasn't touched a carb basically in 8 years, and I don't know. I don't know his perspective on this. I haven't seen much of his recent content. I know Mark Bell said he's friends with him. Not necessarily agree with because of that. So, yeah, healthy carbs that I speak of. So healthy carbs are the ones that have either plenty of fiber surrounding it, or that they have a lot of starches and they're more like resistant starches, and then they're less likely to spike your blood sugar. We do recommend some sprouted grains here and there if you want to try that. We do recommend some types of fruits like blueberries, strawberries, even though they have some fructose on it. Um, I've even changed my mind on apples a little bit. Lentils like chickpeas have some proteins that have some fat on it. I think can stuff like that. And just measuring your blood sugar and making sure the spike doesn't last long. The problem is not so much the spike. The problem is when the spike lasts long. So those are kind of some versions. Steel coat oats, more than oatmeal, more like steel coat oats can be an option if you want to try some of that. Amy Farrell, if I start adding carbs to my diet, my type 2 diabetes comes back. Carbs are inflammatory bowel to get worse for me. I avoid them, and fiber, I get much improvement. Yeah, I mean, I think that's a fair point, but I also think we have said on the show, we don't necessarily demonize carbohydrates. We are mostly against processed and refined carbohydrates compared to whole foods. So I think there is a place and there are some options for carbohydrates. Of course, if you want to keep it carnivore, if you want to keep it high fat, keto diet, more strict, that's okay, go for it. I just think that there is a case to be made when you introduce some carbohydrates and still remain low carb in order to improve muscle mass. Doesn't Jason Fung say that you will not lose muscle mass while fasting or eating carnivore if you have lots of adipose tissue available for energy? I haven't seen Dr. Fung say that, but I will challenge that. I think you might not be losing to you might not be losing too much muscle if you were not doing that, but you still lose some muscle. I can tell you, like I did a 5-7 day water fast with some sardines in it, and I was already doing a kind of a more ketogenic diet, more than low carb, with tons of protein and fat, and I did lost like 30 pounds, but I of course I wasn't able to measure that here over in Mexico, but I can tell you for a fact I felt that I lost some muscle mass as well. So I think you do lose some of that. The key is just doing like what Dr. Brewer did. Whenever he does a prolonged fasting, he loses some weight, but that right after the fasting, he goes back and exercise like a mad person, and he gains back some pounds that are actually more muscle than fat. So that's the way to do it. Uh, uh, Thank you so much. I hope what I'm saying makes sense to you and it's helpful. I'm just trying to provide information for you to make your own decisions. And again, tell me if I'm wrong. I will appreciate that. And some people kind of have called me out before where, hey, I think you're wrong on that. And I go back to the drawing board, go back to review the literature and say, yeah, you were right. I had a misconception. We all grow. Yvonne, climb the hills. That's great. I have a park near me with a big grassy hill, and I pedal with my empty mountain bike. Awesome workout. Yes, cycling, using bikes. Okay, this is the comment that I was looking for. Jesus needs to talk to someone knowledgeable. Sugar diet will lower insulin by restoring insulin sensitivity, removing fat in cells that cause insulin resistance. There is science on paper on that. Yes, I mean, if you burn fat, insulin sensitivity improves. Yes. My point is that is a short-term benefit that will get counteracted the more you get exposed to glucose and the more you're pushing insulin. I think that is the main point. There's the argument to be made, and if there is a paper that shows that prolonged consumption of fruit juice, maple syrup, candy will not increase insulin resistance, I'm all for it. And I can change my mind and say, you know what, we were wrong about sugar. I think it's correct when you say short-term insulin sensitivity. Long-term, I'm not sure. I don't think so. What are your thoughts on taurine supplementation? I think it's fantastic. We don't have that much experience on taurine, but from what I've seen a couple of evidence that might be helpful, but we don't personally recommend it. I think there's a list of other supplements that go before taurine. People who say the low carb doesn't give energy, they didn't go long enough to get fat adapted. Yes, that's exactly my point. When you get fat adapted, that tiredness, that feeling too sluggish, it really goes away. And I'm telling you because I have seen it in patients, we have seen it in research, and I'm living it myself. Dr. Barry is furious about this. Maybe about the sugar diet. I saw some of his video, some part of his video. I think we agree in a bunch of stuff. Maybe not all, but we agree in a bunch of stuff. Never been better. Been all sugar for 2 years. All sugar, like eating too much sugar or just skipping sugar? Barry said, well, she seems logical. I don't know if it's Barry or who looks logical. Uh, yeah. I don't know. What do you mean by that, Matthew? Or are you just a troll? Anyway, as I said, I think the comment that where they said, okay, insulin sensitivity improves, that's the kind of comments that promote creating conversation and making sure that we're talking the same language. And I think once we study this more, that's what we're gonna know. All right. So this last one: 60 years of sugar and carbs all day and no insulin resistance. Praise God. Okay, this is the part where I will challenge a little bit more this assumption of insulin resistance, and I want to close with that. And well, maybe before I go to close with that, I'm just gonna give a shout out to Brent Ditzier. Thank you so much for becoming a member. We really appreciate it. It goes a long way. Mark Bell said it himself. I think he saw that statistic. Up to 50%, a little bit more than 50% of Americans have some level of insulin resistance, pre-diabetes or diabetes, 18 years and older. And most people don't know because the tests they use to evaluate that are usually fasting glucose, which misses 50% of cases, A1C, which can miss up to 70% of cases. And there's the test we use is not a fun test, we acknowledge, but it's the most efficient test, the most accurate test we have at this moment, which is the oral glucose tolerance test with insulin response. And this is the part where the insulin sensitivity will become the thing we need to know about the sugar diet long term. If you tell me that the sugar diet is capable that long term keeps your blood sugar levels steady, keeps you off fat, keeps you off of fatty liver, and keeps your insulin levels low, I'll say I'm wrong. I mean, go ahead and let's test those people who have been doing the sugar diet for a while. And let's see if they are actually metabolically healthy. If they're metabolically healthy, I'll say, yes, I was wrong. This is a diet to do. But I don't think that's going to be the case. Because I have heard Mike Bell say he doesn't believe on measuring A1C. He doesn't believe on measuring fasting glucose. He doesn't believe on, he didn't even mention insulin. I think he said that you cannot measure insulin, which that was odd to me. Maybe I'm misinterpreting what he said. Correct me if I'm wrong. So if you fail the oral glucose tolerance test and you fail the insulin response test, then there is some insulin resistance right there. You cannot say that you're insulin sensitive if your insulin is through the roof, fasting or as a response to glucose. And that's the test that you need to look for. So that's the thing. If you are able to test the right way insulin sensitivity and say, okay, I'm doing the sugar diet for a while now, and this is my metabolic panel, and I'm metabolically healthy, which only 70% of Americans are, or even less than that, I'll say I'm wrong. If you're using HOMA-IR to measure that, HOMA-IR is a little bit limited because it only considers fasting glucose and fasting insulin. It doesn't measure the response and the behavior of your insulin after being pushed by carbs. So that's the thing. If using a CGM to watch your glucose level, eat a sugary treat and exercise to the point that your glucose doesn't rise much, is it still damaging your organ? That's a great question. And I think this is a good comment to be made. If it doesn't reaches 140, is less likely to damage vessels. But the one thing we don't have so far is what do you call that? Live or in time, or we don't have insulin sensors. So we don't know how much your insulin is getting pushed. And even though high levels of glucose are more inflammatory than high levels of insulin, high levels of insulin are still inflammatory. So that's a great point. That's why we say test, don't guess. Test it. Just go ahead and test it and see how your body behaves. I'm not saying you cannot lose weight with the sugar diet. I said it. You can lose weight with the sugar diet. What's the trade-off, though? That glucose test puts 75 grams of sugar in your body in one shot. I've never do it if you paid me. I understand that. Some people do not want to do that. And this is what I'm saying. That's the best test that is available out there. The most accurate test, more than 90% accuracy. 90% for OGTT. It goes way beyond 90% when you include the insulin response. And just so you know, 75 grams of sugar is something that people who are eating McDonald's will get with one of those meals and a soda. There's 75 grams of carbs, a little bit more on a Coke, regular Coke. So if you are on the route of I don't want to do carbohydrates at all, I don't want to do the test, that's okay. I'm just trying to give you a perspective on how there is a lot of people who are insulin resistant and they don't know it because they're not testing the right way. So I really appreciate the comments. I think for those who are in favor, for those who are against, review the video. Tell me what I did wrong. Tell me where I failed. Tell me where you don't agree with. I think that's a fair conversation to have because at the end, if there's a trending topic, anybody who wants to try this, I think you have the right to have as much information as you can and make your own decisions and do it right there. One thing here, craft insulin is 100 grams, yes, but we standardized to 75 grams like the OGTT. So you can do either 75 or 100 grams. We haven't seen that much difference from those extra 25 grams. I just wanted to mention that because I saw it. Okay, all right before the hour. Thank you so much for staying here. We'll be looking forward to have Dr. Brewer next week. I'll be working on that members video for you guys, and we're planning on posting on Saturday. So stay tuned. Thank you so much, and see you next week.